All right, good morning, everybody, to the COVID-19 response Anchorage EOC operational update for September 30th. Roll call. Weather? Were there any China? All right, emerging infectious diseases?
Here.
Logistics?
Present.
Finance?
Good morning.
Public information?
Good morning.
And liaison?
Good morning.
I hear.
All right, situation overview. Today is day 578 of the response. Locally, cases are up 2,974, 27 deaths, and 40 hospitalizations. For statewide, cases are up 3,002, 76 deaths, and 95 hospitalizations. For 213 resource requests, we've filled or satisfied 1,814. Since last report, we filled 6, and we're currently working 29. For mass care, congregate shelters are totaling 373 clients. Non-congregate are 450, for a total of 823 clients. For testing and vaccines, over the last 7 days, we've sampled 7,030, and total vaccines for all pods are up 2,897 for a total of 88,205. End of report. Mass care. Go ahead.
Good morning, everyone. As far as quarantine and isolation, we have 6 people to be discharged today, and we have 30 projected discharges over the weekend. We permanently housed 6 people through the efforts of intensive case management last week, and a total of 55 people permanently housed through mass care and Catholic Social Services efforts. End of report.
All right, thank you, ma'am. Moving on to weather. Go ahead.
Morning, this is Ben with the National Weather Service. Only thing really of note is we'll have increasing cloud cover this afternoon and a 50% chance of rain tomorrow. After that, going into the weekend and early next week, typical fall weather and downtrend in the temperatures with highs in the low to mid 40s and lows just below freezing. End of report.
Thank you, weather. Emerging infectious diseases. Go ahead.
Good morning. At our testing sites, we are focusing on CDC guidelines on who should and shouldn't get tested at the Visit Healthcare sites. So focusing our resources on those who are symptomatic or close contacts and continuing to message other testing opportunities for travel and asymptomatic surveillance testing. Our testing sites at Visit Healthcare had a 9% decrease in average daily tests as compared to last week. That was a 10% decrease in the drive-through locations and a 4% increase at facilities for priority populations. Turnaround times for Visit Healthcare are averaging 30 hours, and approximately 9% of tests muni-wide were positive in the last 7 days, indicating we are missing cases and the community may not be accessing available testing. On vaccinations, as a reminder, Pfizer booster doses are recommended for people who are 65 and up, long-term care residents, people 50 to 64 with certain health conditions, and in addition, people 18 and up who are high risk due to health conditions or occupational exposure may also receive a Pfizer booster. Visit Healthcare vaccine clinics had an 89% increase in average daily vaccinations as compared to last week, currently averaging 162 doses per day. We have upcoming mobile vaccine clinics today at Sullivan Arena, 49th State Brewing tomorrow, at the Hotel Captain Cook on Saturday, and also at Girdwood Library and the Enlaces Health Fair, Sunday at Lusac Library. As always, vaccine clinic information for our sites and others can be found on vaccines.gov, anchoragecovidvaccine.org, and via the state call center, 907-646-3322. Public information about monoclonal antibodies is available on our Muni COVID website under the treatments tab and via the state call center. Again, that's 907-646-3322. And as a reminder, we still have 2 large monoclonal antibody facilities to offer infusions to the public. And a report.
All right, thank you, ma'am. Contracts and logistics, go ahead.
Good morning, this is Wendy Reese, Contracts and Logistics Section Lead. All mass care contracts are extended through 10/31. We are currently working the extensions through 12/31. Testing and vaccine support, the testing and vaccine contracts with Visit Health ends on 10/31. Logistics, there are currently 29 resource requests in a ready for order status. One of those being personnel in support of operational functions. End of report.
All right, thank you, logistics. Finance.
Good morning, this is Audrey Jo Malone reporting for Finance. Current encumbrances are at $15,782,966, with actual spent to date of $83,356,186 for a total of $139,139,000 for expenses by way of federal funding. Total FEMA funds paid to MOA to date is $27,424,539. And please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. End of report.
Thank you, Finance. All right, for safety, we're moving into the winter season. So winter safety beyond COVID-19. We're looking at winter driving safety. Before winter hits, ensure that your vehicle is properly in working condition, including tires, fluids, batteries, and brakes. Have an emergency kit that contains blankets, flashlights with batteries, jumper cables, ice scrapers, emergency flares, bottled water, and snacks, and a bright cloth or sign to let others know that you need assistance. Also, winter walking hazards, prone to slips, trips, and falls are a top hazard any time of the year, but the risks are higher in the winter. Use proper footwear, ice and sand in the parking lots and sidewalks, and place wet floor signs around the building to remind visitors and workers of the hazard. And as for mental health, seasonal affective disorder, or SAD, is a type of depression that comes and goes in a seasonal pattern. The dark, cold months can make people feel a bit lazier and sad. Take advantage of the sun when it comes out and get some fresh air. Take some frequent breaks. Invest in a special lamp that stimulates sunlight for sims, and encourage employees to take days off when things become overwhelming. Moving on to public information.
Good morning, everybody. Public information is working on messaging primarily regarding the booster vaccines. It can be a bit confusing for some about who is eligible, and also the difference between the booster vaccines and the third dose for the immunocompromised. So that information has been added to the MOA COVID-19 website, and we have been messaging about that on social media. We are also continuing to let people know that monoclonal antibody treatment is available. We understand that is pending inventory right now, but it is available in Anchorage, and they should talk to their healthcare providers if they have questions about that. They can also call the state hotline also, which is 646-3322. And we're also continuing to let the community know where they can get tested or vaccinated, including at-home vaccinations will be coming up in Eagle River on October 5th. And that ends the report for public information.
Okay, thank you very much, ma'am. Moving on to liaison officer. Go ahead.
Good morning. This is Riel Welch, the liaison officer for the Anchorage Emergency Operations Center. Thanks to all of our partners who were able to join us today. Do we have any cooperators online that would like to report out? Okay, is the state of Alaska on to give a report?
Mark Roberts with the State Emergency Operations Center. I can note two things for you real briefly. One is we issued an order for a disaster medical assistance team, DMAT, from the Federal Emergency Management Agency yesterday. They are traveling today. They will be emplaced at the Alaska Native Medical Center to decompress that hospital. And we moved one of our mass fatality trailers from the State Medical Examiner to the Alaska Native Medical Center. And that's two actions we took in the last 48 hours.
Thank you for that update, Mark. All right, next slide, please. Next slide. All right, let's get started with our hospitals. Is anyone online for A&MC?
Hi, good morning. This is Lori Olson reporting for Alaska Native Medical Center. We have 30 positive COVID inpatients, 10 in the ICU, 4 on vents. End of report.
Thank you for that, Lori. And Sean, are you online for Alaska Regional?
I am. Can you hear me?
I can.
Oh, excellent. Alaska Regional Hospital currently has 32 COVID positive patients, including 1 ED COVID hold. We have 12 in the ICU, 11 vents. Staffing and bed availability remain our pinch points currently. End of report.
Thank you for that, Sean. And is anyone on from Providence, Alaska Medical Center?
Yes, this is Michael. We have 44 positive patients, 9 in the ICU and 7 on vents. Of course, that does not actually encompass all of the COVID impact because there's a number of people that came in with COVID but have not been discharged. And of course, staffing remains very, very tight. It would be
Michael, this is Sean Murphy.
It would be interesting from the state if they're anticipating any additional NDMS resources coming into Alaska.
So this is Mark Roberts with the State EOC. I'm not aware, besides a request for medical equipment like ventilators and dialysis machines, I'm not aware of any other NDMS coming into the state at this time. We can check on that. We do obviously have the Government Services Administration contract executed by the Federal Emergency Management Agency and the state of Alaska that is providing the medical providers, and those are beginning to flow into deployment now, 475.
Thank you.
All right, thank you for that. And is anyone on from Matsu Regional?
Good morning, it's Kara Cahill from Matsu Regional Medical Center.
Sorry, Kara?
Yes.
Kara, I apologize for interrupting. Was that Michael that was asking about additional resources from Providence?
Yes.
Hey, Michael, if you have additional needs or resources, can you talk with us about that offline at the EOC?
Yeah, we had just spoken with the state a couple of weeks ago about NDMS resources, so I didn't know if there was any more information about that.
Okay, thanks, Michael.
All right, this is Kara from Metsi Regional Medical Center. I'll go ahead and report. Currently, we have 42 positives, 15 in the ICU with 15 on vents. End of report.
All right, thank you. And that's the end of the report for liaison.
All right, thank you very much, ma'am. And we have the new health director online, if you would like to say something.
I'd like to say thank you for everyone making the call. I can't thank you enough for being part of this. Realize we want to be an active resource for you. I know Amanda has been, as we assume the lead agency role on this response. Just realize the health department is your local resource. We'll be the conduit to the great folks at the state, whether that's the EOC or Gene Wiseman and his crew. So I just want to say thank you for being here. Thank you for keeping us in the loop. And we would appreciate any and all data to help us make these informed decisions, can kind of lean forward. So I truly am honored to be in your presence and get to work with all you fine folks. So thank you for this opportunity to speak and keep up the amazing work. We're at day 578, and that is a sustained operation in any world. And, just keeping motivation up during this time has been amazing, and everyone's still positive. So thank you.
All right, thank you very much, sir. All right. Do we have any questions out there?
Hi, this is Greta Wade with the Anchorage School District. I would like to know about the visit contract ending on 10/31. It was a little bit confusing because it also mentioned in the previous bullet that there was going to be an extension of contracts until 12/31. Was that including the visit contract? And if not, who will be doing the testing for the Muni, testing and vaccination clinics for the Muni?
So I can clarify the 12/31 extension. That is for our mass care contracts. That does not include the testing or the vaccine contracts. The second part of your question, I do not have the answer to.
I'll speak to it. So as you know, I'm day 9 on the job. We are working with Visit Healthcare right now. And of course, this is a matter to be back before the assembly. But we are working on some opportunities. There is other testing opportunities provided by DHSS in town. So it would not be like, even if there was a minor interruption or a change in direction, we are working to have testing and vaccinations extended through the end of the year. That is a complex item that we're working on. But just so you're aware, we have instituted some proposed changes. It requires us to go through legal and several other things, as it is a contract revision. So those are all in play at this time, but I don't have a firm. It will be extended to December 31st, sitting here this second. But we initiated several action items in the last 4 or 5 days since I came over here. So hopefully we'll have some answers before the next operational period. If we do, it'll be released beforehand, but we should have some firm answers by end of week and definitely by next operational briefing.
Thank you. I appreciate your effort. The Anchorage School District has expanded our testing extensively, and it's important to us to know what other resources people have in the community. Thank you.
Absolutely, and we're looking to loop back around. We had a meeting with the school district last Friday, as you're well aware, and we're looking to loop back around and be a partner with those home test kits that are inbound. There's a lot of changes to testing coming to Anchorage. So I think that that's all very dynamic as we go to home test kits, what that looks like, how to assist the people that test positive. So we're ready. We're making the changes.
Hi, this is Jocelyn from the Alaska Hospitalist Group. I apologize. I was dealing with an acute staffing issue and I missed the opportunity to speak. But I just wanted to mention, so our group covers the ICU and medical admits for Providence, St. Elias, Central Peninsula, and Matsu. And, you know, what we're really finding is that with the Anchorage hospitals backing up with higher volumes, it's really putting a lot of pressure on the outerlying facilities. And so we're having, you know, some physician staffing kind of volume concerns and, you know, because we're having to keep, you know, more sick patients, higher acuity levels into our outerlying hospitals. And so I know there was potential talk of getting additional physician resources, and I don't know if the munis do anything with that or if that's just the state, but you know, we continue to have concerns with the numbers that are being reported. I think this is every day is a little bit of a different scene as far as, you know, where we're at with being able to take patients in Anchorage or not, and sort of the impact that has on the state overall. You know, our group obviously remains very committed to providing ICU support for the entire state, even if that is sometimes just guiding providers in Juneau to keep sick patients, et cetera. But, you know, just to underscore the kind of concern with the ongoing situation and the increasing numbers, knowing that the hospital admissions are lagging indicators. So sorry to be late for that report and put it into the Q&A, but I just wanted to state that.
Mark, could you give an update on kind of, or if Jean's on, the GSA contract and how those priorities kind of went out, or what we've done so far that might relieve some of their questions that are coming in?
Well, that's for nursing, and I'm aware of all that, so that's okay, Jean.
Okay.
There was a question, Jean, that potentially some hospitalists or intensivists would be available, so you and I can talk offline if you don't have that information. But
Okay. If there's no other further questions, the next operational update brief will be next Thursday, October 7th at 10 a.m. Everybody have a great day, and thank you for coming.